Hello, welcome to Learn from the Case. How are you? Today I want to do a little explanation about diabetes. So it will be a video on internal medicine, endocrinology. Someone asked me if the HbA1c that is used to evaluate blood glucose levels will be missing in patients with sickle cell anemia, thinking that hemoglobin A is the hemoglobin that is glycated and that these patients do not have hemoglobin A. Well, that is not like that. HbA1c does not indicate that is hemoglobin A that is glycosylated. All hemoglobins can get glycosylated. However, there are marked shortcomings in patients with anemia of any type when it comes to measuring long-term glucose with HbA1c. Let me explain myself better. HbA1c is hemoglobin irreversibly glycosylated in the N-terminal valine of the beta chain. HbA1c measurements are based on the unpredictable effect of glucose concentration on hemoglobin during the normal lifespan of red blood cells, but any condition that alters red blood cell survival may invalidate HbA1c as an accurate measure of glycemic control. It's no longer reliable. Iron deficiency anemia is associated with higher HbA1c concentration among pediatric patients with type 1 diabetes, despite good blood glucose levels. Iron replacement therapy can also result in a substantial drop in HbA1c in both diabetics and non-diabetic subjects. Hemoglobinopathies may affect HbA1c by altering glycation, interfering with the assay, or making erythrocytes more prone to hemolysis. Therefore, hemoglobinopathies can lead to falsely high or low measurements depending on the variant, the method, and specific assay used. For example, in beta thalassemia or sickle cell anemia, there is a high concentration of fetal hemoglobin, which consists in 2 alpha and 2 gamma chains. Certain immunoassays specifically identify beta chains and do not detect the glycosylated gamma chains seen in high hemoglobin F levels, resulting in a falsely low HbA1c results. Hemoglobin S or hemoglobin C or hemoglobin E are pathological. This is a known limitation of immunoassays. The NGSP, National Glycohemoglobin Standardization Program in the US, provides an overview of various HbA1c assays and possible interference with hemoglobin variants. Furthermore, these patients will have red blood cells with a markedly shorter half-life, and the hemoglobin that is glycosylated in these red blood cells will also have a shorter half-life. It will disappear more quickly, thus showing reduced percentages of HbA1c that are not related to the average blood glucose content. Hemoglobin has a quaternary structure. It is a tetramer formed by the union of 4 polypeptide chains, also called globins or subunits. 2 of the alpha type of 148 amino acids and 2 of the beta type of 146 amino acids, and the heme group, which is the prosthetics group, that is a non-amino acid component that is part of hemoglobin. This heme group is a small piece of iron that is attached to each globin and that adheres to oxygen. Heme is also found in other blood proteins, such as myoglobin, cytochromes, catalysis, and endothelial nitric oxide synthase. But well, to know what type of hemoglobin a certain person has, an electrophoresis is done to see the variants of hemoglobin in the red blood cells. In adults, it will normally be with hemoglobin A1 95 to 98%, hemoglobin A2 2 to 3%, hemoglobin F 0.8 to 2%, hemoglobin S 0%. Hemoglobin S is a variant of hemoglobin resulting from an alteration of the structure of beta globin. Of the 4 polypeptide chains that form hemoglobin, 2 alpha and 2 beta, the alpha are identical to the normal hemoglobin. Hemoglobin A is the normal, but there is an alteration in the beta chains. These have an amino acid valine in the place normally occupied by a glutamic acid in the position 6. This exchange is a consequence of a point mutation in the chromosome 11. Those who watch the sickle cell anemia videos remember this alteration. It gives rise to a disease that can be very serious, sickle cell anemia. That's right. Hemoglobin S is associated with sickle cell anemia. And last, hemoglobin C, also 0%. To follow the plasma glucose levels in diabetic patients, we use glycated hemoglobin, HbA1C, but there are also glycated albumin, fructosamine, and 1.5 anhydroglycidol. HbA1C is widely used as a reference index for glycemic control in clinical practice, although HbA1C reflects the state of long-term glycemic control over the past 1 to 2 months is that not accurately reflect glycemic control in the clinical state in which glycemic control improves or deteriorates in the short term. Also, as I say, HbA1C in patients with hematological disorders such as anemia and hemoglobin variant shows an unreliable value. On the other hand, glycated albumin and 1.5 anhydroglycidol reflect medium or short-term glycemic control and are not influenced by hemoglobin metabolism. While 1.5 anhydroglycidol is known to reflect postprandial plasma glucose, glycated albumin was recently shown to also reflect postprandial plasma glucose. What is good is that glycated hemoglobin, HbA1c, is a non-enzymatic glycation product of hemoglobin. Once HbA1c is formed, it remains in the body until the red blood cells are destroyed. In other words, this is good for diabetes controls in patients without hematological disorders that alters this measurement. In addition, large-scale studies shown that the occurrence and development of diabetic microvascular complications correlate with HbA1c. 1.5 anhydroglycidol and glycated albumin are indices that overcome this weakness of HbA1c. They offer the benefits of reflecting glycemic control in patients with hematological disorders and also reflect postprandial plasma glucose. Furthermore, while HbA1c reflects long-term plasma glucose, 1.5 anhydroglycitol and glycated albumin are indices that reflect short and medium-term plasma glucose. 1.5 anhydroglycitol is a polyol with a structure in which the first position, glucose hydroxyl, is reduced. It is contained in a wide variety of foods and is barely metabolized in the body. Therefore, 1.5 anhydroglycitol in food forms a reserve in the body after being absorbed in the intestinal tract and is widely distributed in various organs. Fructosamine is the general name of glycosylated proteins that are converted to a stable ketamine and is measured by a chromogenic reduction reaction with nitroblue tetrazolium as a substrate by utilizing the strong reducing power of fructosamine in an alkaline solution. Fructosamine is not affected by anemia or the hemoglobin variant, since the metabolic turnover of albumin, which occupies most of the serum protein, is faster than that of hemoglobin. The measurement of fructosamine can be used to test diabetes. So HbA1c is indeed found in patients with sickle cell anemia, but it is not a reliable analysis to follow a patient with diabetes or to diagnose diabetes. And although it is currently the reference index for glycemic control, it has important flaws. Does not accurately reflect glycemic control in various diseases, and it is difficult to judge the effects of a drug to treat diabetes mellitus and check the deterioration of glycemic control in the early stage because HbA1c does not accurately reflect short-term glycemia. And with this last thing, I say goodbye today. As always, you are welcome to leave me your comments or questions. Thank you for the attention and be very, very well.